Hello, I'm your host, Ashmina Tour, and you're listening to Diving Deeper into Dentistry. Through this podcast, I hope to spread more awareness about dental anxiety and dentophobia. In today's episode, I am joined by Dr. Anisha, who is an orthodontist at Thrive Dental and Orthodontics. And today, I will be asking Dr. Anisha a couple questions about dental anxiety and orthodontics. But before we begin, Dr. Anisha, would you mind sharing a little bit about yourself and your experience with dentistry and orthodontics?
So hi everyone, my name is Anisha. I went to the University of Southern California for my undergrad, and then I went to the University of California, San Francisco for dental school, where I obtained my Doctor of Dental Surgery degree, and then I went back to USC for my orthodontics residency. And then upon finishing residency last year, I moved to Dallas, where I am now practicing full-time in a few practices.
Thank you so much. So the first question I have for you is, would you mind defining dental anxiety in your own words or based upon your experience with patients?
Yeah, so I think dental anxiety is just this fear and anxiousness that comes with people when they come to their dental appointments. Sometimes it's kind of associated with the fear of the unknown, about what's happening to them. Sometimes it's associated with their fear of needles. There's a lot of different factors that can kind of contribute to that discomfort. But I feel like over time, and now that there's been so much awareness around it, I think all dental practitioners have kind of been tackling how to reduce that when they come to their appointments.
Mm-hmm. And the second question I have for you is, what would you say are the causes of one's dental anxiety?
I think there's a lot of research about this, and I think a lot of it points to how they had their dental experiences when they were kids. So I think a lot of it is shaped by their childhood experiences. So if someone had a really good experience when they were really young with their pediatric visits, I kind of tend to see that I didn't really have that many issues with them when they came to the general dentistry side of things, or even when they come to the ortho side. Those that, they say that they were tied down and they were extracted, teeth were extracted, and they remember screaming, and, they felt like the anesthesia was wearing off, and they had this very vivid memory of this really horrible experience that seems to carry through all their future dental experiences, even though it's nothing like that. So I think really just that initial impression of dentistry and those initial experiences kind of shape how you view it.
Mm-hmm. And what would you say are the most common symptoms you see in your patients?
Symptoms of anxiety? Mm-hmm. I think for the most part, just being scared of when you're about to anesthetize them for a general dentistry appointment. Usually when you're kind of explaining the treatment plan and they're concerned about all the cavities they have or all the things that they have to do, and just, kind of trying to plan ahead and just thinking about those upcoming appointments. So I think honestly it's just kind of like just the fear of the unknown, to be honest.
Mm-hmm. And would you say that it is common in orthodontics, or is it more common in dentistry, you would say?
I don't actually find it as common in orthodontics. I think for the most part, I've been pretty blessed to work with really good pediatric dentists and general dentists that have done a really good job of shaping our kids' initial experiences of dentistry, so that by the time they're old enough to come to that first initial appointment with me, usually they're pretty familiar with the dental environment. They're not really anxious or scared when they come to sit into the chair and have me talk about aesthetically aligning their teeth or functionally aligning their teeth. And if I do kind of get a sense that they are pretty anxious or they are pretty uncomfortable, then I usually kind of make the recommendation, unless it's pretty severe, to postpone doing orthodontic treatment until they're more mature and able to kind of equip themselves with this environment.
Okay, I see. And how do you assess dental anxiety if you do see it in your patients? Do you think it's pretty visible, or is there a certain procedure that you'd use?
Yeah, so for the ortho side of things, my first exam with them is usually a pretty quick exam. Usually we just take pictures, we take a very quick x-ray, and then I just do a 1 to 2 minute exam, kind of looking in their mouth, looking at the functional bite, and just kind of how their teeth are sitting in both arches. So it's a very quick exam, so I can kind of gauge from those 2 minutes if that person is screaming or, kind of pushing my hand away, or really nervous, or really just not having a good time in that short amount of time, then I know that for the duration of orthodontic treatment, whether it be 1-2 years, that they're going to struggle constantly throughout it. So I kind of assess from those 2 minutes, if I'm getting any type of pushback, that's that's when I know, okay, this person is a little anxious, and we gotta kind of transform the dental experience before they come to me for orthodontic treatment.
Okay, that makes sense. And then, how do you treat patients who suffer from dental anxiety? Do you use sedation, or is there something else that you do?
Yes, we definitely don't use sedation for orthodontic treatment. I never want, just over treat someone for, just for braces.
Right.
So like if I sense anxiety like that, I usually, if it's within the realm of I can wait like 6 months to a year before starting, then I try to do that. If it is something pretty severe that we do need to start, the next thing that I would do is really just hone in on patient education. So, showing the shape of their jaws, showing their relationship of the way the teeth are articulating with one another, showing the discrepancy that I'm seeing right now and the possibility of it getting worse. And then talking about, the things that could happen if they don't treat it, so that maybe, the comfort of treating it right now and not having those future issues might kind of outweigh that anxiety that they might have of coming to us. Mm-hmm. And then really, like, the number one thing is, like, the minute that person walks in through the door, usually, like, we go above and beyond to make sure that that person has really excellent experience. Like, everyone that they talk to is really nice and very warm and very educational. Everyone knows every step of what we're doing. So just kind of like educating them and just making sure that there's no fear of the unknown, that they're really aware of every single part and everything that's happening to them. I feel like that also kind of relieves their anxiety a little bit if they have any.
Mm-hmm. And would you say it is more, like, is dental anxiety more common among a certain age group?
I would say, like, in my experience, I find that dental anxiety is pretty common in the younger age group. So usually for orthodontic consultations, our recommendation is that we want to start seeing them at 7 years old. Mm-hmm. And even if we don't do treatment on them, we just still want to just see how their teeth are coming in, then we'll see them every 6 months. So at that 7-year mark, some kids are still a little young. Some kids maybe just haven't had that dental exposure yet, or they're just in a certain stage of life where they haven't, been able to mature to the point where they can do this like long orthodontic treatment. So I think like the most anxious patients that I see are at that age, but sometimes I see them the next year and they're okay. So it really just depends on the person, I think.
Right. And the last question that I have for you today is, what do you wish people knew about dental anxiety or orthodontics in general?
I think I wish people knew about dental anxiety is that I think more so from the insurance side of things. Like, I wish insurance is covered like nitrous oxide and more of those mild sedation procedures for adults, because even though I do see it more in kids, I think it is it's a pretty big problem for adults too. Like, I think no matter what the age, people are always kind of nervous when it comes to anything like needles or injections, or even just being in that very personal space of a lot of adults are really, self-conscious about. And for insurances to be able to provide that mild sedation just to make the whole experience a little bit better would honestly just to encourage people to continue to come to the preventative dental appointments and probably reduce their need for really expensive treatments in the long run. So I just wish, more so for people, but more so for insurance companies, I would love if they understood dental anxiety on the level that we do, so that they could cover those procedures for everyone.
Right. Thank you so much, Dr. Anisha, for joining me on today's episode. We really appreciate your responses and for you taking the time to join me on today's episode. So thank you so much.
No problem. Thank you so much for having me.
Of course. Thanks for listening to this episode of Diving Deeper into Dentistry. I hope you enjoyed it and gained more insight into Dr. Anisha's perspective on dental anxiety as well as its symptoms and treatments. Please be sure to subscribe so that I can join you again soon and provide you with more information about dental anxiety. If you like this episode, please feel free to leave a review. Thank you so much for listening, and I will be back with another episode later this week.